So that's a good question, but I think is the wrong question. Because I
Okay.
think once we diagnose ADHD or think about it, I think we should think about ways of treating the condition or helping individuals with that. And a lot of times I actually like to take the approach with patients as opposed to looking at you as being ill or having a mental sickness that needs to be fixed with medicine. I also actually like to look at my patients and people who are suffering from that or have been affected as this is sort of signature of the brain, is a way of being in the world. In certain conditions, there's also strengths to ADD that no one talks about. I think my experience with ADD is that creativity is higher, a sense of empathy is higher, a sense of standing for justice is higher. And no one really exactly knows why, but I think part of it is that when your brain is going on and off in different directions, there is a more of an understanding of variety of different ways that human beings exist. So I think the question, instead of jumping right away into medications, is that what are the things that help? And my approach is always first sorting out categories of different conditions that people are suffering from. So most of my patients, actually, I would say rarely anyone comes in and has one condition. So our job is to sort out if there's a comorbid addiction developing with the condition of ADHD. If they meet the criteria, the approach is very different. If there's comorbid severe mood disorders, the approach is very different. Sometimes diagnostically it's impossible to sort out ADHD from severe forms of anxiety disorder and some forms of bipolar disorder. There's a big presence amongst ADHD community. I think there's a more propensity towards post-traumatic stress disorder. So not to make it very complicated, again, in kids, and there's a lot of literature, medicine or not medicine, but again, I think by the time someone comes to my practice, my job is, I see it as sorting these various approaches out. And behavioral interventions and even sometimes minor adjustments in environment really helps the patients more. After having said that, then medications are also very effective. Probably in all fields of brain health and mental health, the role of various classes of medications in ADHD is amongst the most robust and researched in all fields of medicine, I would say, because up to 80 to 90% of patients can find a solution in addition to the behavioral solutions medically. And then we can go to details of that if you have time and information. Yeah. That's a very good question. I wish I had an answer that would say there's a particular test, I just come and do a bionic biopsy without going into your brain and say, this is what you need and that's how you're going to do well. That's not the case. But the way medicine goes, and especially in behavioral medicine, no, I think it's not exactly trial and error. It's based on the medical studies we have to see what works. So if your issues were, for example, that emotional sensitivity and anxiety that comes with ADHD, then there are non-stimulant medications, for example, atomoxetine or Strattera is one of the few medicines that is approved for ADHD. It's not a controlled medicine. It has its own set of side effects. But there are some studies that show that it helps with the anxiety component better. Its effect size, which means sort of a statistical way of measuring how effective these things are, is not as good as psychostimulants. And psychostimulants are those scheduled drugs that most people associate with ADD. There are basically two classes of them with different packaging. Methylphenidate is the Ritalin family. And amphetamines, which are the ones that are Adderall, and again, each of them have about 50 different variations and packaging. And the mechanisms of actions are similar amongst the psychostimulants, a little bit different, a little bit perhaps more complicated amongst the amphetamine family. But the key is setting the goals initially in treatment, looking for what needs to be done. And also medicine doesn't solve everything. So the medicine is a startup point. For example, if I have ADHD and if I am placed on a Adderall type medicines or Vyvanse or one of these long-acting stimulants, and we can talk about the differences between those, that doesn't work on my motivation. I can focus and read better 90% of the time, but what I read is different. So instead of doing this on your Saturday, you could have gone and done something else. Maybe your bowling game would have improved, but it wouldn't help your bottom line in your classroom and the things you're doing, between you and your friend. So sometimes people declare medicines not working, not because the medicines are not working, because the goals were not set properly. And then as far as how we choose the dosing, that's really something that you have to have a very experienced clinician. It really, there is science and there is art behind it. And I'm one of the few doctors that, not a few, but I like to sort of actually be wary of potential side effects of these medicines and start on a smaller doses and adjust them accordingly. Of course, according to body weight, certain the way liver metabolizes these medicines, and we're learning a lot more genetically. Some of us are slow metabolizers of byproduct of these medicines because what we're doing is raising dopamine and norepinephrine in certain parts of the brain, mostly frontal cortex, which increases that level of attention. So the main goal of the way you look at these medicines is that what you want to do, we have a default attention, and then we have something that is related to a task we're doing. For example, right now you could be thinking about what you're going to do later, what dinner you're going to have, how much fun you're going to have, go to the gym or whatever. But your attention goes back and forth to my boring comments because that's what your task is geared towards. So what I'm, I guess, saying is that with the dosing of the medicine, it really is geared towards measuring those parameters and working with them. And so it's not exactly trial and error, and a lot of times combining various classes of medicines lowers your need of relying on one class altogether and managing the side effects. Yeah, well again, I recommend treatment for ADHD. And then everything has to be measured with risks and benefits. It's like saying that, do you recommend tacos? You have to look at the risks versus benefits. So if ADHD is properly diagnosed, I want people to be aware that there are options and choices and treatments available. And sometimes dietary changes. I've had people who don't eat all day, have a donut and a cup of coffee, and they're wondering why they're anxious all day and they can't pay attention. So you need to really change that first. But of course I recommend medications. And then I go over the risks and benefits, and we have to be very careful and cautious because if we're talking about psychostimulants, they have their own set of side effects: cardiovascular, weight loss, appetite loss, agitation, sleep problems, those are just a few, stomach pain, those kinds of things. With atomoxetine or Strattera, we have to be careful with things like liver toxicity, cardiovascular problems. And then there are some medicines that are not controlled. They're in a different family of drugs, but they're used off-label for ADD. For example, like bupropion or Wellbutrin, and just mentioning a few, and sometimes even other classes of antidepressants, like tricyclic antidepressants, have been used for ADD. Again, it depends on what we're trying to accomplish and comorbidity of the condition. I would say I've not seen two individuals with ADD that they look alike. Well, the pros is all the things we're gearing towards. I've had people that it's actually I've had people that just sit there in the parking lot and cry because imagine all your life if you're not treated. Now you've had the blessing of having educated parents, good doctors, in an environment that you could get help, look at stuff, somebody fussed over you to be able to be as successful as you are. But routinely I see people who are in much later phases of their life, in their 20s, 30s, 40s, and they feel themselves that there's something missing, that they are stupid, that there's actually the name of a self-help book on ADD. It's called I'm Not Stupid, Lazy, or Crazy, because those are the most common labels that are applied to ADD people. Or you're just dumb, you're not going to go anywhere, you're an imposter, you're not going to make it, you can't sit through stuff, what's the matter with you? So a lot of the ADD people, patients have a very poor self-image that they have unfortunately been dished out to them. And so the main part of my work is actually to say that, no, let's make sense out of this, let's bring you out. And I especially think in the inattentive type, it's become quieted down and people don't talk about it. A lot of times ADDers, during adolescent years get into impulsive behaviors, drug abuse, driving experiences are very dangerous. There are reports that ADHD afflicted persons get into accidents more. But at the same time, I want to also remind people, a lot of times they don't know that much more intuitive abilities, much more insightful into people, much more empathy and reading people, much more creativity. And it's amazing in what circles you find ADDers. physicians, lawyers, artists, writers, people in jail, drug addicts, drug dealers, you know. So you have to really look at that, and at least if we can alleviate part of that problem that is associated to a reversible condition of the brain, you can really help people. Well, again, I am, I think that question probably is more relevant to child psychiatrists because you might have two parents involved, and unfortunately, if they're even divorced, and one parent's agree, one parent doesn't. My thing is that I actually don't enjoy, because these are selective treatments. This is not something that if you don't take it, you die. There are ways of managing ADHD without medications for some people if they want to. So I don't get myself in the position of I suggest something and they absolutely aren't refusing it. Then the point is that these are other options, and then maybe you can get yourself educated and we can come back to the drawing board. Actually, the problem comes the other way. If somebody comes to my office and they insist that there's only one medication that helps them, they've been on it and they have a history of addiction, then that's when people are kicked out of my office. Not in that sense, but that's like we have to come up with a different plan, because at the end of the day, this is not, some people make it into such a simplified picture that, hey, I have ADHD, I took the questionnaire, give me stimulants, and I do well, and that's not the case. So they have to be part of a program. I think once you put your trust and you study the physician that is going to be working with you, you allow her to work with you and decide along with you to be a source of education. So that I run into problems the other way more, when people insist on medications and I have to educate them that there's a problem.
Oh, I've always heard it's the other way around, that people insist that they don't.
No,
That's a
not in
first
these.
for me.
For adults is all the time the other way. Because no one is going to come make appointment, not no one, but insist to be seen, incur all the medical costs, and to say I don't want treatment. A few people I teach them. I've had traces of ADHD, and I learned a lot of behavioral things. I was on top of my medical school class, but the way I learned, for example, by studying, is that I moved a lot, I highlighted a lot, I make a lot of charts and colorings. I like to make things interesting and exciting, so those are some of the behavioral things that make a big difference. And we're so used to having, in our culture, a neurotypical approach. You sit there in the library and you study. There's not enough variations. You can be running back and forth. And now, fortunately, in some of the workplaces, you can have a treadmill at work. Even as a physician, you can stand there and type your notes as you walk a little bit. So that takes care of that hyperactivity. I think the fidgeting things that they have in schools, that's a really cool thing. I wish I had that in school.
Have you found that fidget spinners actually do work?
I'm not fidget spinners, but in school, these chairs that they have, the kids can put their leg and move around. That really is helpful. But the spinner by itself, no.
Okay, I found that out too.
No. Because fidgeting has to be your way. So yours might be something different. I like prayer beads and stuff. I go and I'm but this thing, it becomes almost like an obsessive compulsive annoyance. I don't like it. But if I could, if you're my patient or you're my doctor, I would like to have the flexibility that it would say, we've talked for half an hour, I'm bored. Let's go run and come back. And that would be the kind of stuff that I would like to have ADHD friendly systems allow it. Unfortunately, the new companies like Google and stuff, you can come and go anytime. They have comfortable chairs, you can bounce around, because a lot of these very creative engineering type who are bright, they also have a comorbid ADD type propensity. So I think your generation are going to introduce hey, there are different ways of doing